Day, everyone. It's Hump Day, and we're so glad you're able to join us for our latest IPS webinar, Advancing Social Change Through Logic Models. This is something we've been wanting to do for a long time, and so I hope you find it useful. Next slide, please. My name is Brenda Simmons. I'm the Chief Executive Officer for the Institute for Public Strategies, and I'll tell you a little bit about our organization. We are a public health agency focused on partnering with communities to create social change, create positive, sustainable social change. We've implemented programs throughout the nation focused on everything from substance abuse to food security to human trafficking. And right now we have offices throughout Southern California, in Washington State, Montana, and Maryland. We've been around for 30 years, and we've worked across the nation and specialize in designing and implementing programs and providing training and technical assistance to create community change at a population level. And so everything we're talking about today is going to be targeted at programs that operate at a population level, or sometimes that's called environmental or community level, or upstream prevention. Next slide, please. And today we are here to, of course, talk about logic models as a framework for problem solving. Logic models can be powerful tools, but they're often developed and used primarily for research and evaluation purposes, and this makes them intimidating for implementers. This webinar is designed to provide practical support for creating and using logic models at every stage of public health campaigns, policy advocacy efforts, and community change projects. We're going to walk through a process of creating a hypothetical logic model for advancing social change that identifies the necessary resources, inputs, outputs, and the change that you're hoping to create in the world. It incorporates underlying values, beliefs, and assumptions that inform the design and the approach of the project, and it will help effectively move from research to practice. This webinar is intended for program and project implementers. It's coming at this from the angle of implementers. Not all projects have the luxury of having a researcher on board or an evaluation person on board. And we think it's valuable to look at building logic models from the lens of implementers so that they're useful to implementers. But before I start, I want to let you know right up front that we're not researchers at IPS. We work with researchers, but we're program implementers. And this webinar is about looking at logic models from an implementer's perspective. So I'm not going to talk to you about how to write SMART goals or try to act like I know everything there is to know about logic models. I do not. What I'm going to talk to you about is establishing a vision for change and mapping out how to get there in one approach to a logic model. Next slide, please. But let's start with a question. And we have a poll that we're going to do. And so I'll have Meredith do the poll. The first question is, have you ever created a logic model? And the second question is, do you refer to a logic model regularly in your work? If you can use the poll icon at the bottom of your screen and answer these questions, that would be wonderful.
We'll just give some time for everybody to fill out this poll. We're getting there. Just a few more seconds. And just a couple more. And I'm going to end the polling at this point. Thank you all for those who contributed. So Brenda, question number 1, have you ever created a logic model? 68% responded yes, 32% responded no. And for question number 2, do you refer to a logic model regularly in your work? 31% responded yes, and 69% responded no.
That is kind of what I expected. And the fact that 68% of you have created a logic model and only 31% of you use it regularly use a logic model regularly in your work is what we usually see. And so hopefully what we can do is walk you through a process of creating a logic model that you will actually use. And so we'll start by defining what a logic model is. It shouldn't be oh, next slide, please. A logic model is simply a graphic depiction of how you're going to create the change you want to see in the world. It shouldn't be intimidating. It's simply a graphic of the process and how you think you're going to achieve your vision. It's a problem-solving tool. You could use it to plan a Thanksgiving dinner for 50 people. And so if you think about it that way, it just needs to make sense. It needs to get you to your end goal or your vision for change. In addition to Thanksgiving dinner, you can use your logic model to advance social justice issues, destigmatize mental health, address health disparities, or reduce obesity. So let's take it from the theoretical to the actual now, and we'll create an actual example. Next slide, please. We're going to focus on a logic model for underage drinking prevention. And so we're going to start with some basic assumptions. These are our underlying values, beliefs, and assumptions, and they will be different for every agency and can change from project to project. Our basic assumptions and our values and beliefs are fundamental to our approach. And so it's important that everyone who's working on the project, whether it be staff or community members or even policymakers and other people that you're trying to influence, understand what your basic assumptions are. So it's not something you just put on paper. It's something that you use to drive your decision making. And so these are basic assumptions that apply to IPS. Again, it can be different for every agency, and it can be different from project to project, topic to topic. But basic assumptions for underage drinking prevention programs at IPS is that they should be data-driven. That means that we should use data to understand the problem, and we should use data to measure change over time and to inform the planning and implementation process, and then to evaluate the project. Underage drinking prevention should be integrated with other health prevention efforts also. Things like suicide prevention and unplanned pregnancy prevention, school dropout prevention. We don't want to be working in silos. We want to be working across interrelated issues so that we are bringing a diverse array of groups and interests together to achieve similar results. Successful prevention efforts include communities as full partners in decision making. That's really important to IPS, and who better to drive change in communities than communities themselves. And we want flexibility within a community to develop prevention infrastructure suited to the context. Every community is different. They're living, breathing entities, and you can't just plot one evidence-based program from one community to another. They're quite different, and things aren't necessarily going to work the same way. We talk about at IPS evidence-informed projects rather than evidence-based, because we aren't trying to do a cookie cutter approach for all communities. And then prevention approaches that address the social, physical, and legal environments affect entire populations. And that's what we want to do with our underage drinking prevention, is affect youth throughout the community, not just a set of youth, a set of fifth and sixth graders that are going to move on in a year, and then there's going to be another set of fifth and sixth graders. We want to create change across entire populations. And we know that policy, social, and physical changes in a community is what can do that. Also, we think it's important that knowledge and skills of cultural awareness and sustainability should be incorporated in all aspects of a prevention framework. So this creates the foundation for our logic model. We actually build it into the logic model. You can move to the next slide, please. So it's the first thing you see in our logic model. And then we're going to jump to the last thing you see in the logic model. We are going to start with the end, because if we don't know where we want to go, there's no way we can plan how to get there. So we want to know what we want our long-term outcomes to be. In this case, we want a reduction in underage drinking. We want a reduction in injuries and fatalities and other harms associated with underage drinking. We want a shift in cultural norms towards challenging underage drinking. And we want sustainability of efforts through ownership and resource expansion, so that underage drinking, the way this program impacts underage drinking is sustainable long after the program is gone, and it's owned by the community and carried on. Next slide, please. Actually, I'm going to back up for a second. What I want to say here is a lot of times we put in logic models arbitrary numbers that reduce underage drinking by 2%. It's a guess of what kind of impact we think we can have. And I think it's really hard to judge that. We know we want a reduction, and we know we want to measure that in a multitude of ways, but the arbitrary numbers aren't always helpful. And it's sometimes what makes an implementer put a logic model in a drawer, because it seems like the long-term outcomes don't connect super well to the short and intermediate outcomes. And it doesn't seem like it's going to produce this arbitrary amount of reduction in underage drinking, let's say 2% in a community. I know we've had several projects. We had a border project several years ago, and it was a cross-border underage drinking project. And within a few years, less than 5, there was a 32% reduction in the number of kids coming across the border in the middle of the night on weekend nights with any alcohol in their system. 32% reduction. We could not have predicted that. And we had a statewide Montana strategic prevention framework grant, and it increased the perception of harm in parents and youth, and in a significant number. And it would have been almost impossible to predict what that number would be early in the project. And so I think while it's valid to create SMART goals and put those numbers and make sure that you're identifying the population you're trying to create change in, these kinds of population level programs impact everyone. And it really is difficult to apply a number up front, at least from an implementer's perspective. I don't want to tell researchers or evaluators how to do logic models. This is, again, from the perspective of implementers. If we can move on, Meredith. And so we're adding that to the end of our logic model, and we're going to work our way backwards. So next, we're going to look at the short and intermediate outcomes that we need to achieve to get to these long-term outcomes. So I'm going to work on the right column first. And one of the things we're going to need, this is again a program about changing policy. And one of the things that we need to do if we're going to influence policy is have increased involvement from diverse community groups in implementing initiatives, and increased community support for prevention efforts. So there needs to be, communities need to embrace the types of policy changes that you're trying to create. And so do the diverse community groups. And the policymakers need to hear from these diverse community groups. So you get them on board, and you end up with increased participation of residents in policy decision-making, improved policy decisions related to underage drinking, increased adherence to policies related to underage drinking. And you can see how those things can impact your long-term outcomes. But to get to your intermediate outcomes, you're also going to need a shared vision and plan. You can't have increased involvement of diverse community groups and community support for prevention efforts if you don't have a shared vision with the community and a plan developed. And you want to increase the skills demonstrated by coalition members and community partners. That means increasing their ability and their comfort level in participating in policy-making decisions, regular residents. And you want to get the issue of underage drinking on the public agenda, increase community awareness of the problems, and increase willingness to collaborate across issues, making it relevant, making underage drinking relevant to large sectors of the community. Increase data and resource sharing. This is going to be really important when you're establishing metrics for your program and informing your planning and implementation process. And then increase knowledge of barriers to change. So really, you're needing to achieve these short-term outcomes to get to your intermediate outcomes. And I don't want to say complete all the short-term outcomes and then you move to your intermediate outcomes. These are going to be intertwined, how they're moving forward. But how do you get there? So great, shared vision and plan and increased skills demonstrated by coalition members, but how do you get there? These are the inputs. Next slide, please. So you can see where the short and intermediate outcomes fit into the logic model. And the next slide is the inputs. And inputs are things like data collection. Now that you know what you're trying to achieve, not only your short and intermediate outcomes, but your long-term outcomes, you can collect, you know what baseline data to collect and what data to collect throughout the life of the project. You know what your plan is, and you're able to collect data to inform the project as you implement that plan. Your community organizing has shape to it. You're trying to achieve certain things with your community organizing, whether it be putting a a sector leader group together. We have a binge and underage drinking initiative project in San Diego County, and we have a sector leader group. So it's fairly highly respected sector leaders from the community, and they advocate for change, but we provide them with education and data and everything they need to be able to do that kind of advocacy. So we build their capacity. We do media advocacy. So we are getting things on, that's how we get things on the public agenda. That's how we create a community of advocates that are widespread. Spokespersons training. This is teaching people how to go in front of city council, how to talk to policymakers, even one-on-one. Policy development, identifying policies that actually science has shown make a difference. Things like policies that restrict alcohol outlet density, because we know density is related to underage drinking rates. And then, of course, compliance monitoring. These things are all intertwined to begin to advance your short and intermediate outcomes. And the pace at which you advance your short and intermediate outcomes really has to do with the dosage of your inputs. Are you collecting the right data? Do you have what you need to move your project forward and plan and implement? Is your community organizing healthy and vital? Are you engaging diverse community groups and people who are influencers? Do they have the capacity? Does your staff have the capacity? Does the community members you're working with have the capacity to advance the short and intermediate outcomes? Are they trained as spokespersons? Do they understand policy goals and what works and why it works? And is there compliance monitoring going on to see if you're having an impact with either policies that are already in place or new policies that go into place? So these are your strategies. These are how you're going to work, the types of activities you're going to do to achieve those short and intermediate outcomes. Next slide, please. And so the inputs fit right before the short and intermediate outcomes. And then finally, we look at resources. So you understand where you're going, what you want, what your long-term goals are, what your vision is, what you're trying to achieve, and how you're trying to achieve it, and what strategies you're using. And so now you can identify what kind of resources you need. You may already have the funding source identified before you do a logic model, but what kind of resources are you going to need? Can you leverage existing partnerships? Can you get training and technical assistance and capacity building support? Can you get data training and technical assistance and help monitoring and evaluating the project, especially if you don't have a professional researcher or evaluator involved? That's often a luxury to most projects. So you're identifying the resources. I'm going to go back to the Thanksgiving dinner. What kind of resources are you going to need? Well, you're probably going to need some people to help you. Some people on cleanup, some people to help you cook, maybe greeters that are going to help you during the Thanksgiving dinner. And you're going to need the food. So have you set aside coupons and things so that you can afford to feed 50 people? Or what kind of resources are you going to need? Do you have family members that are going to help you pay for it? And what kind of recipes are you going to use? Are you going to get the recipes from your grandmother's house? It's just looking at the resources that you need to move through the short and intermediate outcomes. And so then we end up with a complete logic model. And that's great. We work backwards through the logic model and we've created it. Now we need to use it. And so where that starts is actually looking forward now. So you start with your basic assumptions and you make sure that your partners and everybody you're working with have agreed upon the basic assumptions. Maybe you create your basic assumptions together with your community groups. And then you move into your resources that you need and you make sure you're securing those resources. You're finding the kind of training and TA support that you need. You're leveraging different resource streams and braiding them together. You're leveraging existing partnerships and you're able to do, even though you don't have a researcher evaluator, you're able to find data and have assistance with monitoring and evaluation through, you know, groups that do that for different agencies. And oftentimes there are free resources out there. SAMHSA has Substance Abuse and Mental Health Services Administration at the federal level, has resources that help groups working on underage drinking prevention that you can tap into. They have federal resources and then they have regional resources. So then we move to our inputs. And you see how the resources and the inputs fit together. You need the data to be able to, you know, find and collect the data that you need. You may need some support in developing surveys or doing focus groups. You can leverage your existing partnerships to build a coalition or do community organizing and bring people into your project. You may need some technical assistance in building the capacity of your staff or building the capacity of your community members. Or maybe you have that resource in-house. You need to be able to do media advocacy. You might need support with that. What is media advocacy? Well, that's where spokesperson training comes into play, teaching people to write op-eds. And again, speak to policymakers, but the resources need to support the activities that you're going to do. Because if you don't have the resources to support those kinds of activities, you're not going to be able to move forward to your short and intermediate outcomes. Next slide, please. And so here we look at data collection. Well, we need to establish some metrics around or process evaluation around the different short-term and intermediate outcomes to see if mid-project and early in the project, you're actually moving forward. Is there increased community awareness in the community? And how are you going to measure that? Is there increased willingness to collaborate across issues? And how are you going to measure that? Is there increased community support for prevention efforts? How are you going to measure that? And then the community organizing. Did you have to form a coalition? And how did that go? And how are you going to measure that? And have you engaged the right community influencers to actually create change? Have you been able to build the capacity of your staff and your community members so that they can advance to these short and intermediate outcomes? And part of that building capacity is being able to do media advocacy and spokesperson training, develop model policies, and engage in compliance monitoring. So you can see how the inputs fit together with the short and intermediate outcomes. And not only that, the dosage of the inputs is critical. Because if you're only bringing 5 people together to create a vision and a plan, and you don't have a lot of diversity at the table, it's probably going to be really difficult to increase community support for prevention efforts, or increase community awareness of the problem, or maybe it's apathy that you're trying to overcome. Having 5 or 6 people at the table isn't going to work. And I don't think the metric is the number of people that come to a meeting, but actually, are they engaged in the project? So those are the kind of metrics and data collection that you understand now, because you've identified your short and intermediate outcomes. You know what baseline data you need to collect and how you're going to measure these short and intermediate outcomes. Next slide, please. And this brings us back to our full logic model and the long-term outcomes. And the thing about it is it's logical and it makes sense. If you operate on a certain set of basic assumptions and that drives the project or provides a foundation, and you have identified the resources you need to do data collection, community capacity building, coalition building, media advocacy, etc., then you're going to be able to achieve these short and intermediate outcomes. And the whole idea is that if you can achieve these short and intermediate outcomes, you will reduce underage drinking. You will see a reduction in the harms associated with underage drinking. You can create a shift in social norms that involves challenging underage drinking. And you can create sustainability. So they flow together from left to right. So you're building it backwards, but you're using it moving forward. Again, it's not completely linear. You're going to be identifying resources all along the way. You're going to find different strategies all along the way that are helpful to you. Your short and intermediate outcomes don't happen in a linear fashion. They overlap. And the long-term outcomes, usually there's not a destination. It's a journey and a process, and you want to make sure you're moving in the right direction and that you've got a feedback loop, so that you know you're moving in the right direction. So that'll take us to our takeaways for today. And the first one is, don't be intimidated. This is something anyone can use, and anyone can use it for a foundation, for a project, and for working with your community groups, not just you, but working with your community groups. If you aren't sure what to do and you create a logic model like this and you get stuck somewhere, go back to your strategies that you have in your logic model and go back to the short and intermediate outcomes. So what strategies are you using, and what short and intermediate outcomes have you not met? And so how are you going to do that? And if you're focused in on those and you're not doing things outside of that, you have a very focused program that can achieve your vision, your long-term outcomes, which is the change you want to see in the world. Next slide, please. State your basic assumptions. These are fundamental. They're foundation. We don't do this, and we should. And it gets everyone who's working on the project, community members and all, on the same page. Next slide, please. Begin with the end. Start with your vision for change. Start with the change you want to see in the world and focus on that and build your logic model based on that. And use this logic model that you can create as a guide, not only for you, but for your partners. You will find it will keep people on track. And they'll understand if they're suggesting to do something, if you bring them back to the logic model, if they're suggesting to do something that's way out of the realm of the short and intermediate and long-term scope of the project. And the fifth takeaway, the most important one, use it. Don't put it in a drawer, put it on your wall. Give it to your coalition members. Refer to it regularly at coalition meetings. Measure where you're at on things regularly. Look at the data to understand what you've achieved and if you're moving in the right direction. And if you're not achieving any of your short or intermediate outcomes, you may need to adjust your strategies. And thank you very much. I'm going to go ahead and take some questions now. And I've got my email address on here and my and our website. And also, I just wanted to say that we're going to take some questions, but we also have a survey at the end that we really want you to fill out. So stick around for that, please.
Thank you, Brenda, for this presentation and for sort of demystifying the whole process of building and using logic models. As someone who is just starting to use them myself, I found this information very helpful. We do have some questions, and also as we are answering them, there is a link here to our survey. If you do have a QR code reader on your phone, kindly scan the code and fill out the survey. We really would appreciate it. This helps us inform our webinars planning as we go forward. And then I apologize, but I did not also introduce Sarah Blanche. She is our Vice President of Operations in our LA office. And so Sarah is also going to put a link to the SurveyMonkey, to the survey in the chat box, so you can also access it there. So Brenda, let's see here. Thank you, Tricia, for your comment. And yes, we will provide a copy of the recording and the presentations afterwards. One question we have is, this seems like a lot of strategic planning. What would you say is the main difference between logic model planning and strategic planning?
That's a great question. What I would say is logic model planning comes first, and then your strategic planning is focused around your inputs and how you're going to use the inputs, like data collection and capacity building and all of the other activities you're going to be involved in to advance your goals. And one of the first things you're going to do is create that plan, generally with your community members, so that you are able to build it with the strategies you've identified and build it so that it's designed to meet the short and intermediate outcomes. So this is a fundamental document, but your plan is generally going to be more focused on the strategies or activities, or in this case, what we're calling the inputs.
Thank you. Are there additional resources such as books or articles that you recommend for further study of logic models and their results?
You know, I don't. I'm coming at this, I've read a lot about logic models, and most of the stuff I've seen really looks at logic models from a research and evaluation perspective. And so we put this together because we think it's helpful to look at it from an implementation perspective. But honestly, I haven't seen that specific kind of approach talked about in the literature or most of what I've seen about logic models.
And for the next question, sometimes policy creation in the political arena can be mundane and like a large task to complete. How can you create policy by using certain logic models without the use of legislation or some type of political pathway?
Mm-hmm. Well, I would say that we define policy broadly, And so these might be administrative changes. It might be things that happen in schools. It can be processes and procedures. It doesn't necessarily have to be public policy. And so, or legislation. So you need to look at really basically what the research says, how different policies will impact underage drinking or suicide or racial justice and that kind of stuff. And if there are, and there typically are, ways to influence through processes and procedures and practices and programs that aren't legislation.
Okay. So for incorporating accountability amongst community stakeholders and community buy-in, how often do you recommend we collect and analyze the data?
I would say at least every 6 months. I think you're wanting to have a feedback loop and see where you're at within achieving your short and intermediate goals along the way. And I would say if you're measuring your long-term outcomes, that you're going to want to look at those at least annually.
So this probably is similar or answers this question. How often should a logic model be revised or updated?
I think you need to be flexible, and you're going to run into roadblocks that you didn't think about. You're going to need different resources or more resources than you planned. You're going to use strategies that you hadn't thought about. And there may even be some additions to your vision. Your vision may change slightly, and your short and intermediate outcomes may change. I would say revisiting that logic model every 6 months and making sure it's relevant is a critical piece to this also.
Okay. And do you suggest setting up subordinate logic models for coalitions, projects, and activities that align with an overarching logic model?
I think if you can simplify and do a subordinate logic model for coalitions, or maybe you have an internal one that's fairly complicated and you simplify it out for different coalitions and groups that you're working with, I think that would be fine. So you kind of have a sub. We work with a lot of researchers, and they create a logic model, and we tend to internally, we look at that and we use that as a basis, but we create our own logic model that is from that implementation angle, so that it aligns with the logic model of the researchers and evaluators, but speaks more to the implementation.
So this is both a comment and a question. Thank you for making this so accessible to non-public health researchers. As an MPH, I've used logic models with my staff at a community health center, and it was so beneficial. I found that folks get caught up in the outcomes portion. What strategies would you recommend to helping community members approach this section, meaning the outcomes section?
Yeah. And I think what happens a lot is you identify your outcomes, your vision for change, which is critical. It's the first thing you do, but you're not going to jump from your resources and your inputs to a few key short-term and midterm outcomes quickly. And so it's going to be a process. And I think what's important is to make sure that what you're doing flows together. Does it make sense? It's supposed to be logical. Does it make sense that these short-term and intermediate outcomes will actually produce this long-term outcome? And instead of getting hung up on there, the work is in moving forward the short-term and intermediate outcomes. The work is the plan you develop around the inputs. And so I think you're really right. It's not getting caught up in the long-term outcomes. I do think that the short-term and intermediate outcomes, as long as they flow together with the inputs and the strategies that you're working with. It's not terrible to get caught up in those outcomes, but knowing that the inputs are the strategies you use to get there. I hope that answers your question.
And it looks like we have just one last question. Can you speak a little bit about how this could be applied to address the built environment, meaning making sure that there are adequate open spaces and parks?
Mm-hmm. Well, I think, public policy around parks and open spaces are a great way to address, whether people have access to safe parks, that kind of stuff. Is there adequate lighting? Is there security where there needs to be security or patrols? And so that is really critical. I know one of the things we're looking at in one of the cities we're working in is it's a fairly large city, and the money for parks and rec and those kinds of things is distributed based on the tax base. So you've got fairly invested in communities that have had long-term investments, and they have beautiful, amazing parks because they have a higher tax base. And then you have working families living in a place where the tax base is lower. And so you're not collecting as much in the tax base, and you're getting less money for your parks. And so your parks look nothing like another part of the city. And if you can restructure things, get the city to restructure how they allocate funding for parks, you can create some equity around having healthy open spaces and parks in communities that maybe have been divested in the past. So that's just an example of how you might do that.
And we had just one other question come in. How forest preserves, how do we promote these in most states?
I don't know anything about promoting forest preserves in states. I think it sounds wonderful, and I am not going to be able to answer that question for you. So, but I think you could easily walk through a logic model process like this, follow it and identify, especially if you want to take a policy approach, how to impact that. And I did see one other question from Beatrice, who asked if assumptions are meaning what you assume the issue is. And not at all. That's not at all what we mean by assumptions. If you go back to the assumptions are that the program is data driven, so that you're not deciding what the issue. Well, you may be deciding that you're funded to do underage drinking prevention, but you don't know exactly what the problem looks like. So you're doing data collection to understand the issues around underage drinking, the context in which it's happening and how you can influence it. That you're working at a population level. Maybe you're not all working at a population level. So those are fundamentals, basic assumptions. So not at all meaning that you assume what the issue is.
Great. Thank you so much again. That concludes our webinar. If you, IPS does offer training and technical assistance for all of our core competencies. And if you're interested in learning more, please do reach out to us at info@publicstrategies.org. Check out our website at publicstrategies.org, and also follow us on Facebook at Vibrant, Healthy, Safe Communities. Thank you so much, Brenda.
Thank you. Thank you. It was a pleasure. I hope people found this useful.